Welcome! This series of tutorials aims to inform diagnostic laboratories about the new regulation on in vitro diagnostic medical devices, the IVDR. Please note that the implementation of the IVDR is an ongoing process and many aspects remain to be clarified. This means that new information will become available continuously. Please visit the ESLO website for more information. 4. Preparatory Action 1. Dedicated team and education. Based on the requirements for in-house devices, there's a number of actions that diagnostic labs can take to prepare for the date of application of the IVDR. This will be the topic of this and the next two videos. The first action is to appoint a dedicated person or a small team that is responsible for IVDR compliance and to make sure that they are educated on the topic. Learning about the IVDR is a continuous process because the implementation of the IVDR is still in progress. New information becomes available all the time, so it is good to try and stay up to date. An important information source is of course the IVDR itself. It is good to read at least the parts of this regulation that are relevant for diagnostic labs, but also other parts can really help to understand the IVDR and the requirements for IVDs. Then there are the official guidance documents from the Medical Device Coordination Group, the MDCG. This group consists of members from the European Commission and the competent authorities of EU member states. The MDCG drafts guidance documents on a range of topics to explain specific rules and requirements of the IVDR and to provide more details. For example, guidance on the classification rules was published in November 2020. There will be a guidance on the Article 5.5 conditions for in-house devices, which is planned to be released later this year, and there are various other guidance documents in the pipeline, such as the one on performance evaluation. Most of these documents concern CE-IVDs and are meant for manufacturers and notified bodies, but they can also contain relevant information for in-house devices because of the overlap between requirements for CE-IVDs and in-house devices in Annex 1. Then, there is a number of relevant ISO standards. The ISO 15189, which is the QMS for medical laboratories, the ISO 20916 on performance studies for medical devices, and ISO 22367 on risk management for diagnostic laboratories. By now, also a series of informative publications have been published, some of them in scientific journals. The publication of the Leuven Group with the inventory of diagnostic tests, a publication on the implications of the IVDR and preparation for the IVDR by diagnostic laboratories, and one from a Dutch task force with their interpretation of the Article 5.5 conditions and a cross-reference table comparing Annex 1 and ISO 15189. You can also find publications or white papers from other parties. MedTech Europe, which represents the medical device manufacturers, published various papers on medical devices on their website, for example on clinical evidence. Consultation sessions. This will differ per country, but in some countries the competent authorities organize consultation sessions for the different stakeholders in which they provide information and facilitate interaction between the different stakeholders. Also, there are many national and international meetings, conferences, webinars, courses, etc. on the topic of the IVDR. Finally, one action that is highly recommended is to join or to start up IVDR initiatives with the aim to exchange information, share experiences, develop guidelines, etc. Such initiatives have been initiated and are being initiated on many different levels. For example, on the institute level, between university medical centers, within and between national medical associations, and also European medical associations. So it is a good idea to check out what is within reach or what can be established. This will not only be really informative and limit the work that an individual lab needs to do, but it is also most likely that collectively developed guidelines will become the standard that is also accepted by the competent authorities.